So now we're going to start the discussion about the glands. Now in glands, first we're going to discuss about the parotid gland. Right. So parotid gland, some basic points we're going to see. Parotid gland is a serous gland. Okay. And the parotid gland is coming from ectoderm. It is ectodermal origin. And the parotid gland is formed by 6th week. Okay. Right. So now next, what is the location of the parotid gland? Parotid gland is situated in the parotid bed. The parotid bed is formed by, what is the boundary? Now see the diagram. Yes. Now this is a parotid bed. Parotid bed is here only. This is our parotid bed. The parotid gland is present here only. Okay. Now what is the boundary for the parotid bed, sir? Now see the diagram. Now we're going to zoom this image. This is the side view of the skull, and we're going to zoom this image so that a clear idea about the parotid bed. Now see the diagram. Yes, the same image we zoomed. Now this is anterior. I'm writing as A. So parotid bed boundaries. So please write parotid bed. Anteriorly, we have the ramus of mandible. Okay, this is posterior. Posterior side, we have mastoid process. Posteriorly, mastoid process. Okay, above, we have this one, external acoustic meatus. Above, so above, we have external acoustic meatus. And on the medial side, can you see one sharp projection there, like a knife? That is medial side. That is the styloid process. So medially, we have styloid process. Yes. So that is the location of the parotid gland. That is boundary for the parotid bed. So parotid gland is present here only. Okay. Right. Now, next, what are the coverings of the parotid gland? See, coverings of the parotid gland, like any gland, parotid gland also have true capsule and the false capsule. So coverings of parotid. So now true capsule. So true capsule is like the other capsules, which is derived from the condensation of the fibrous stroma. Condensation of the fibrous stroma. For any gland, the true capsule is formed by the condensation of the fibrous stroma only. Now false capsule. False capsule is derived from the neighboring fascias. Now the false capsule of the parotid is coming from the investing layer of deep cervical fascia. Is coming from the investing layer of deep cervical fascia. The investing layer of deep cervical fascia will provide the false capsule for parotid gland and submandibular gland. Okay, right. So now the false capsule is having two layers, superficial lamellae and the deep layer. The investing layer of deep cervical fascia is providing the false capsule. Now this is the gland. The gland is like this. Okay. So the investing layer will provide the false capsule, and that is divided into superficial lamellae and the deep lamellae like this. Now the superficial lamellae, this is the superficial lamellae or superficial layer of the false capsule, which is attached to the zygomatic arch. Okay, this is a false capsule, the investing layer. Provide the false capsule. The false capsule have two layers, superficial layer and deep layer. The superficial layer attached to the zygomatic arch, and the deep layer, the deep lamellae, attached to the tympanic plate. Later, this deep layer is going for thickening and forms one ligament. That ligament is coming from the styloid process to the angle of mandible, and that is called stylomandibular ligament. So this ligament I'm talking about. So stylomandibular ligament is nothing but it is the thickening of the deep layer, the deep lamellae of the false capsule of the parotid. Now see this ligament. Now above this ligament, yes, this fossa is called parotid fossa, and below submandibular fossa. Okay, so this ligament separates parotid fossa from the submandibular fossa. Parotid and the submandibular fossa. Okay, so this ligament separates parotid and submandibular fossa. Okay, right. So that's all about the coverings of the parotid gland. Next, we're going to see the borders and surface. Okay, now parotid gland is having three border, three surface. So now we're going to draw some line diagram. Now this is the parotid gland. Just have some idea about the border surface. Now we have three borders for the parotid gland. Okay, now this is anterior border. Border means the sharp projections are called borders. Posterior border and medial border. So we have three borders for the parotid gland. Okay, now between the three borders we have three surface. Now between the anterior border and the posterior border we have superficial surface or lateral surface. Superficial or lateral surface between the anterior border and the posterior border. Fine. Now between anterior border and the medial border, which surface? Anteromedial surface. This is anteromedial surface. Now between the posterior border and the medial border, posteromedial surface. Posteromedial surface. Okay, so we have three border and three surface. So anterior border is present between the lateral surface and the anteromedial surface. Medial border, which divide the anteromedial surface from the posteromedial surface, and the posterior border present between the lateral surface and the posteromedial surface. Very simple. Three border, three surface. Now what are the relations? Okay, now in the lateral surface or superficial surface, we have only lymph node. Skin, superficial fascia, deep fascia, investing layer, understood. But the main content you have to remember is parotid nodes. So in the superficial surface or lateral surface, we have parotid lymph nodes, parotid nodes. Okay, skin, superficial fascia, deep fascia, understood. Okay, right. Now in the anteromedial surface, see anteromedial surface which is grooved by the ramus of mandible. The ramus of mandible will be here like this, which is grooved by the ramus of mandible. So if it is a ramus of mandible, I told you in the muscles of mastication topic, ramus of mandible which receives two muscles. What are those? The outer surface of ramus, outer surface of ramus, outer surface of the ramus, this is masseter. And inner surface of the ramus, medial pterygoid muscle, very good, medial pterygoid. So outer surface of ramus and inner surface of ramus, yes, we have two muscles. So now anteromedial surface which is grooved by the ramus of mandible and which is related to two muscles. Okay, so this is masseter and this is medial pterygoid muscle. Okay, now what about the posteromedial surface? See, posteromedial surface we have mastoid process and the styloid process. So mastoid process and the styloid process, mastoid process like this and the styloid process like this. Okay, so mastoid process again which gives attachment to two muscles. What are those? So mastoid process, posterior biliary digastric and sternocleidomastoid muscle. Okay, and the styloid process which gives attachment to three muscles. Three muscles, 1, 2 and 3. What are those? From styloid to the tongue, styloglossus. From styloid to the hyoid bone, stylohyoid. From styloid to pharynx, stylopharyngeus muscle. So this is mastoid process. So posteromedial surface, we have mastoid process and the muscle attached to mastoid process. What are those? Posterior belly of digastric and sternocleidomastoid muscle. And this is the styloid process. So three muscles. What are those? Stylohyoid, styloglossus and stylopharyngeus. Now the posteromedial surface also related to internal carotid artery, internal jugular vein and the last four cranial nerves, 9th nerve, 10th nerve, 11th nerve and 12th nerve. So internal carotid artery, internal jugular vein, 9th nerve, 10th nerve, 11th nerve and 12th nerve. Okay. Right. Now these are structures present related to posteromedial surface of the parotid gland. Now, between the stylo process and mastoid process, we have stylomastoid foramen, and the facial nerve passes through and enters the parotid gland. So this is our facial nerve. Okay, I told you, facial nerve emerges from the skull through stylomastoid foramen. Yes. So this is our stylomastoid foramen. I'm writing as SMF, stylomastoid foramen. Stylomastoid foramen. Okay. So facial nerve, after coming out of stylomastoid foramen, enter the parotid gland and divide the gland into superficial lobe and deep lobe. Superficial lobe and the deep lobe. So facial nerve is like a parotid sandwich which passes between the superficial lobe and deep lobe. Now we see the contents such as passes through parotid gland later. So meanwhile, these are the three surfaces we have. Okay. Now see the diagram. Yes, this is a diagram we are seeing. Yes, this is the lateral surface or superficial surface. I told you we have skin, superficial fascia, deep fascia, platysma, and the point is only one structure to remember. That is the main thing they will ask you. Parotid lymph nodes in the superficial surface. Now anteromedial surface grooved by, yes, this is the lateral surface and this is anteromedial surface which is grooved by the ramus of mandible, and we have two muscles, middle pterygoid and masseter. Fine. And in the posteromedial surface we have mastoid process and the styloid process, and we have muscle attached to that, sternocleidomastoid muscle, posterior digastric, and muscle attached to the styloid process. And we also see the artery, internal carotid artery, I'm writing as A, and this is the vein, and between these two, the last four cranial nerves, 9th nerve, 10th nerve, 11th nerve, and 12th nerve present. So that's all about the surface. Now next, we see the borders. See, borders already I told you. Anterior border is present between the anterior border, which is present between the lateral surface and the anteromedial surface. Posterior border is present between the lateral surface and posteromedial surface. Posteromedial surface. Medial border is present between anteromedial surface and posteromedial surface. Okay, fine. So we have three borders. Now posteromedial surface and anteromedial surface, they are separated by medial border, and the medial border related to pharynx. So medial border is also known as pharyngeal border. Medial border related to pharynx. So medial border also known as pharyngeal border. That's all. Now what are structures related to anterior border and posterior border? Now in the anterior border, we see the terminal branches of facial nerve. So terminal branch of facial nerve, we have temporal branch, zygomatic branch, upper buccal branch, lower buccal branch, and the marginal mandibular branch. Between upper buccal and the lower buccal, the anterior border is also related to duct here. The duct of parotid gland, that is our Stenson's duct. I'm drawing in green color, that is a Stenson's duct. Okay, so anterior border is related to these structures. Stenson's duct. Okay, so the temporal branch, zygomatic branch, upper buccal, lower buccal, marginal mandibular nerve, and also a parotid duct, Stenson's duct. These are structures present in the anterior border. Posterior border, very simple. We have one artery and one nerve, posterior auricular artery and posterior auricular nerve. So two structures, posterior auricular artery and posterior auricular nerve. In the posterior border, we have posterior auricular artery and nerve. Okay, right. That's all about the borders. So very simple. We have three borders and three surface. And next, we're going to see the duct of parotid. I told you the parotid duct or the Stenson's duct, which emerge through anterior border. After emerging from the anterior border, this is the anterior border of the parotid gland. The Stenson's duct is piercing the buccal pad of fat, and then the buccopharyngeal fascia, and then buccinator muscle, and finally the parotid duct opens into mucosa of the cheek opposite to the second molar tooth. opposite to the second molar tooth. Okay. Now what are structures pierced by the parotid duct? Number 1, buccal pad of fat, buccopharyngeal fascia, and the buccinator muscle, and finally opens into mucosa of the cheek opposite to the upper second molar tooth. Right. Now, buccinator is pierced by Jensen's duct. Now, what are the other structures piercing the buccinator muscle? So, structures piercing the buccinator muscle. So, please put one box and then write structures piercing buccinator muscle. What are those? Number 1, Jensen's duct. Number 2, buccal branch of mandibular nerve. Please remember, buccal branch of mandibular nerve, not facial nerve. Buccal branch of facial is not piercing buccinator muscle. Buccal branch of mandibular. Okay. And number 3, molar mucous glands. Ducts of the molar mucous glands. These are structures piercing the buccinator muscle. Okay. Right. So now what are the structures which passes through the parotid gland? So structures which present inside, which passes through parotid gland. Again, you have to know in sequence, superficial to deep. Okay. Now, superficial structure is our facial nerve, followed by vein, retromandibular vein, and then external carotid artery. Okay. So this is our facial nerve, and then this is retromandibular vein and external carotid artery. So we have to remember in a sequence, superficial to deep. Again, chances are there to ask in the INACT exam. Arrange the structure sequentially, which passes through parotid gland from superficial to deep. Okay. So facial nerve, retromandibular vein, and the external carotid artery. Okay. Fine. Now see here. Now the facial nerve, after coming out of the stylomastoid foramen, immediately divided into temporofacial and zygomaticofacial. Temporofacial and zygomaticofacial. The temporofacial, which in turn gives temporal branch and zygomatic branch. And zygomaticofacial, which in turn gives buccal branch, marginal mandibular branch, and cervical branch. Buccal branch, marginal mandibular branch, and cervical branch. Okay, right. So now these are the terminal divisions of the facial nerve, and these terminal divisions, they're going to supply the muscles of face. Yes, I hope you know that. See, I told you already in the discussion of border surface. See, facial nerve which divide the parotid gland into the superficial lobe and the deep lobe. Okay. So the facial nerve is dividing. Facial nerve divide the parotid gland into superficial lobe and the deep lobe. I told you facial nerve is like the parotid sandwich which is present between the superficial lobe and the deep lobe. Now, depend upon the cancer involvement, now you may preserve the facial nerve or you may sacrifice the facial nerve. So now we have two procedures: total conservative parotidectomy and total radical parotidectomy. So we have two procedures. In total radical parotidectomy, we remove the superficial lobe, we remove the deep lobe, and we also sacrifice seventh nerve. So these structures are removed: superficial lobe, deep lobe, and the facial nerve. Now total conservative parotidectomy, we remove only superficial lobe and the deep lobe. We preserve facial nerve. That is total conservative parotidectomy. Okay, right. So that's all about the facial nerve. Now next structure is the retromandibular vein. Already we discussed the retromandibular vein in the scalp topic itself, and in the venous drainage of the face, retromandibular vein, one small recall, which is formed by the union of superficial temporal vein and maxillary vein. They unite together to form retromandibular vein. retromandibular vein after the formation, which is divided into anterior division and the posterior division. I hope you know that. The anterior division of the retromandibular vein, which joins with the facial vein to form common facial vein. Common facial vein. And the posterior division of retromandibular vein, which joins with posterior auricular vein to form external jugular vein. Okay, right. And the deep structure passes through parotid gland is our external carotid artery. Right. Now next, nerve supply of the parotid gland. Okay. So nerve supply, yes, we're going to discuss the sympathetic supply and the parasympathetic supply. Parasympathetic supply and the sympathetic supply. Now parasympathetic supply to the parotid gland, which brings out the serous secretions, the watery secretion from the parotid gland. The sympathetic supply, it is vasomotor, and it also brings thick mucus secretions to the parotid gland. So sympathetic supply to the parotid gland, which brings out the sympathetic fibers, which brings out the thick secretion of the parotid gland, whereas parasympathetic fibers, which brings the watery secretion from the parotid gland. Now the sympathetic fibers, the sympathetic supply, which is coming from the plexus over middle meningeal artery, and these plexus are coming from the fibers from superior cervical ganglion. That's all. Okay. Now what are the parasympathetic fibers? Parasympathetic fibers, already we discussed in the mandibular nerve topic itself. Now fibers from inferior salivatory nucleus and ninth nerve, the tympanic branch of ninth nerve, tympanic plexus, lesser petrosal nerve will give the fiber to otic ganglion, and the fibers from the otic ganglion are carried by auriculotemporal nerve, which in turn innervate the parotid gland. I told you auriculotemporal nerve may damage during the parotid surgery, and the fibers regenerate and in turn supplies sweat glands sometimes inside parotid gland, and this syndrome is called Frey syndrome. Already you know this. Okay, right. Next one last thing, applied, and then we can go to the next topic. So now, what are the nerves which may get affected while doing the parotid surgery? Nerves affected during parotidectomy procedures. Okay, number one, just now I told you, auriculotemporal nerve, which may damage during the parotid surgery, auriculotemporal nerve. Okay. Number two, great auricular nerve. Great auricular nerve. Now, great auricular nerve damage means, so great auricular nerve I told you, which carries the sensory fibers from the angle of mandible. The entire face sensory supply by trigeminal nerve, except the skin over the angle of mandible, which is supplied by great auricular nerve. So great auricular nerve damage during the parotid surgery means the patient have loss of sensation over the beard area, over the shaving area. One time they gave this question. 2019 AIMS exam, they gave this question. So the patient complains of loss of sensation over the shaving area or the beard area, that is due to involvement of which of the following nerve. So great auricular nerve damage means the patient have loss of sensation over the shaving area. Okay, right. Now number three, sometimes marginal mandibular nerve may get affected. Marginal mandibular nerve. Sometimes the trunk of the facial nerve may get affected. So these are the nerves, they may get affected while doing the parotid surgeries. Okay, right. So that's all about the parotid gland. See, parotid gland, very important topic. So we have to know the borders, surface, duct, structures passing, nerve supply, everything is important. Yes. And next we're going to start the submandibular gland. So now we're going to start the discussion about the submandibular gland. Submandibular gland, a very small topic. Yes. The diagram, we are seeing the submandibular gland and the sublingual gland. Okay. So this is our submandibular gland and this is sublingual gland. Now submandibular gland and the sublingual gland, yes, they are separated by one line That line is called mylohyoid line. So mylohyoid line, that is the line which divide the floor of mouth into sublingual fossa and submandibular fossa. Above, yes, this is the mylohyoid line. Above is the sublingual fossa and below is the submandibular fossa. Okay, so please write mylohyoid line which divide the floor of mouth into sublingual fossa above and submandibular fossa below. Okay, right. So now submandibular gland present in the submandibular fossa. Yes. Now the submandibular gland, some basic points you have to know. It is a mixed gland. Parotid gland is serous, whereas submandibular gland is a mixed gland. And parotid gland, I told you, which is formed by the 6th week, whereas submandibular gland is formed by the end of 6th week. And submandibular gland, it is coming from endoderm. Okay, so see the difference between parotid and submandibular. Parotid is serous gland, submandibular mixed gland. Parotid is formed at the beginning of 6th week, whereas submandibular gland end of 6th week. Parotid gland, it is coming from ectodermal derivative, whereas submandibular gland endodermal derivative. Okay, right. Now see the diagram. Now as usual, we're going to see the coverings of the submandibular gland. So coverings as usual, we have true capsule and the false capsule. True capsule, it is like for other glands by the condensation of the fibrous stroma, and the false capsule derived from the investing layer of deep cervical fascia. Investing layer. Okay, right. Now see the diagram. Now submandibular gland is having two parts, the superficial part and the deep part. Now we have one muscle. That muscle divide the submandibular gland into superficial part and deep part. Which muscle? Mylohyoid muscle. So please underline mylohyoid muscle and then write which divide the submandibular gland into superficial part and deep part. Okay, right. Now we're going to see the superficial part first and then deep part. Now the superficial part of the submandibular gland is having 3 surface and 2 ends for the superficial part of submandibular gland. Superficial part. So superficial part, this is the superficial part of submandibular gland. See here, keep the thumb like this. Okay, and fit the thumb in the mandible. So this is how the submandibular gland is present. The superficial part I am saying. So we have 3 surface. This surface, this one and this one. We have 3 surface. The one which I keeping in close to mandible, this is a lateral surface. Okay, this is lateral surface. This one is medial surface and this one is inferior surface. So we have 3 surface for submandibular gland. Okay, lateral surface, medial surface and the inferior surface. Okay, now the investing layer of deep cervical fascia, which is covering the inferior surface and middle surface only. The lateral surface, it is not covered by investing layer of deep cervical fascia. Why? I told you, which is closely related to mandible. Okay, so lateral surface, which is close to mandible, which is not covered by the only surface which is not covered by investing layer. Not covered by the investing layer. Okay, right. And this is our gland. So this is the mandible. Okay, and this is the gland. I told you lateral surface is close to the mandible. Now this surface is not covered by the investing layer. Now between the mandible and the lateral surface of the gland, we have an artery. That artery grew and enter the face like this. This is the artery. Which artery? The facial artery. So facial artery is grooving between the mandible and the gland. That is the facial artery. So facial artery which is grooving between the mandible and the gland. between the mandible and the gland. Okay, right. Now what about the inferior surface? The inferior surface of the submandibular gland, superficial surface, it is again related to skin, superficial fascia, platysma. Again, same story only. Again, the point is, which also contains submandibular lymph nodes. Submandibular nodes. Okay, so this is enough. So inferior surface related to submandibular nodes. Now what about the medial surface? See the diagram. In the diagram, we are seeing the medial surface. We're going to zoom this image. So the medial surface, see the diagram. Now medial surface is resting on, it is related to mylohyoid muscle, this muscle, hyoglossus muscle, and medial surface also related to styloglossus muscle. So these three muscles. So medial surface is related to mylohyoid muscle and the mylohyoid vessels, mylohyoid muscle and the vessels, and hyoglossus muscle and styloglossus muscle, and close to greater horn of the hyoid bone we have the hypoglossal nerve, and close to styloglossus muscle we also see ninth nerve, glossopharyngeal nerve. So medial surface is related to all these structures: mylohyoid muscle, mylohyoid vessel, hyoglossus muscle, styloglossus muscle, 12th nerve and 9th nerve. Okay, right. That's all about the medial surface, the three surface. Now what about the deep part? See the deep part of the gland, see the diagram. Now this is the deep part. Now deep part, it is present between the two muscles. Which two muscles? Mylohyoid muscle, very good. And this muscle is hyoglossus muscle. See the diagram. Now the deep part is present between the hyoglossus muscle and the mylohyoid muscle. Right. So the deep part, medially we have hyoglossus muscle, and laterally we have mylohyoid muscle. Okay, right. Next, we're going to discuss about the duct, the submandibular duct. So submandibular duct, which is also known as Wharton's duct. So submandibular duct, Wharton's duct, which emerge from the deep part. The submandibular duct, which emerge from the deep part of the gland. Okay, and see the diagram. The submandibular duct is crossed by one nerve. Which nerve? Lingual nerve. So the submandibular duct, which runs on the hyoglossus muscle, and here which is crossed by which nerve? Lingual nerve, which is crossed by the lingual nerve. That is a question we got in 2022 NEET exam. I told you already. Yes, the structure, the most common structure to get affected while removing the submandibular duct. The most common structure to get affected while removing the submandibular duct. Structure? Lingual nerve. Okay, right. That's a question we got in the recent NEET exam. And the lingual nerve is crossing the duct. Yes. After that, the submandibular duct, which opens into the floor of the mouth, opens in floor of the mouth in the summit of the sublingual papillae. In the summit of sublingual papillae. Okay. Yes. And this is a fate of the submandibular duct. Okay. Right. And next one, we're going to see the nerve supply. The last thing. See nerve supply, as usual, the glands supplied by parasympathetic and sympathetic. So again, parasympathetic secretion, which brings watery secretion from the gland, and the sympathetic fibers, which are helping to bring about the thick, the mucus secretions. The sympathetic fibers are coming from the plexus present over the facial artery. Now these plexus are coming from, yes, superior cervical ganglion, which carry the fibers from superior cervical ganglion. Okay, right. Now what about the parasympathetic pathway? The parasympathetic pathway going to start from superior salivatory nucleus. Parasympathetic fibers, superior salivatory nucleus, from there facial nerve, and then chorda tympani, From cauda tympani, the fibers are given to lingual nerve. Now from lingual nerve, fibers are given to submandibular ganglion. Now fibers from submandibular ganglion, direct fibers from submandibular ganglion, which supplies the submandibular gland and the sublingual gland. See, already we discussed. Okay, in the mandibular nerve topic, we discussed in detail about the submandibular ganglion. Okay, again we're writing the same thing only. This is about the parasympathetic pathway for the submandibular gland. Okay, and that's all about the submandibular gland. So now we're going to discuss the thyroid gland. Some basic points you have to know about the thyroid gland. Thyroid gland is extending from the vertebra C5 to T1. The parts of thyroid gland which contains the two lateral lobes. So these are the lateral lobes, and the two lateral lobes are connected by isthmus. Okay, so thyroid gland contains the two lateral lobes, and the two lateral lobes, they are connected by the isthmus. Okay, right. And next we're going to see the coverings. So coverings of the thyroid gland. So these are the basic points. The two lateral lobes, vertebral level parts, yes. Now we're going to see in detail about the lateral lobe and the isthmus. Now before that, you have to know about the coverings of the thyroid gland. So like any gland, the true capsule is coming from the condensation of the fibrous stroma. Okay. Now what about the false capsule? See, false capsule is coming from the pretracheal layer of the deep cervical fascia. Okay. Now the pretracheal layer which encloses the thyroid gland. Now posteriorly, the pretracheal layer is going for thickening and forms ligament of Berry. So ligament of Berry is nothing but thickening of the pretracheal layer posteriorly. Ligament of Berry is nothing but it is the thickening of the pretracheal layer posterior to the thyroid gland. Now this ligament of Berry is connecting the thyroid gland to the cricoid cartilage. So the Berry ligament is connecting the thyroid gland to the cricoid cartilage. Thyroid gland to the cricoid cartilage. Okay. Now what is the function? I told you in the deep cervical fascia discussion itself, during deglutition, the larynx, pharynx, trachea, esophagus, they move. Now because of this ligament, Berry ligament is attaching the thyroid gland to the cricoid cartilage. So thyroid gland attached to the larynx. So along with the larynx, the thyroid gland also move with the deglutition. So because of this ligament, because of Berry ligament, the thyroid gland and its swellings, they move with the deglutition. Okay, right. That's all about the coverings. So now we're going to discuss about the parts of the thyroid gland. So parts of the thyroid gland, I told you, which contains the two lateral lobes and one isthmus. So now we're going to discuss the lateral lobe first. Now what are the parts of the lateral lobe? Now before discussing the surfaces of the lateral lobe, now this is the apex of the lateral lobe and this is the base of the lateral lobe. Okay, so now we're going to discuss about the lateral lobe. So lateral lobe is having the upper end and the lower end, the apex and the base. Yes. Now the apex of the lateral lobe which reaches up to this line. Can you see the line here? This line. That line is called the oblique line of thyroid cartilage. So apex, it may reach up to the oblique line of the thyroid cartilage. Oblique line of the thyroid cartilage. Okay. So now the apex is related to, the apex is sandwiched between the two muscles. Which muscle? See here. Now this is the thyroid gland and this is the lateral lobe and this is the apex. Now the apex of the gland, the lateral lobe, it is sandwiched between this muscle. Which muscle? Sternothyroid muscle and inferior constrictor muscle. So the apex of the gland is sandwiched between the sternothyroid muscle and the inferior constrictor muscle. Sternothyroid muscle and the inferior constrictor muscle. Okay, right. Now, what about the base? See, the base of the gland, which is related to fifth tracheal ring. The base, which is present over this is the base of the gland, which is present at the level of fifth tracheal ring. Isthmus is present between second, third, and fourth tracheal ring. Whereas base of the gland, which extends one level down, the base of the lateral lobe, which is present at the fifth tracheal ring. Right. Now, this apex and base, it is related to some blood vessels and nerves. Now, the apex of the gland, lateral lobe, is related to this artery. Which artery? Superior thyroid artery and external laryngeal nerve. So, the apex of the lateral lobe is related to superior thyroid artery and external laryngeal nerve. Okay. And this is the base of the lateral lobe. The base is related to inferior thyroid artery and recurrent laryngeal nerve. So, base of the lateral lobe is related to inferior thyroid artery and recurrent laryngeal nerve. Okay, right. That's all about the apex and base. Now, we're going to draw the diagram for the surfaces of the thyroid gland. So, this is thyroid gland. So, thyroid gland is like this. And the thyroid gland is having the covering. Okay, this is the covering, the false capsule covering for the thyroid gland. Okay. So now we have, this is a medial surface and this is the posterolateral surface and this is anterolateral surface. So we have three surfaces, medial surface, anterolateral and the posterolateral surface. Okay. So now we see one by one. Now in the anterolateral surface, we have a muscle. In the anterolateral surface, we have a muscle. The first muscle is our sternothyroid muscle. And then sternohyoid muscle, superior belly of omohyoid muscle, and then sternocleidomastoid muscle. That is superficial muscle. Okay. Similarly, the other side. So SCM means sternocleidomastoid muscle. And this is superior belly of omohyoid muscle, sternohyoid muscle, and sternothyroid muscle. Okay, sternothyroid muscle. So these are the muscles present over the anterolateral surface of the thyroid gland. See the diagram. So first we see the sternothyroid muscle, and then sternohyoid muscle, and then omohyoid muscle, and then finally we see the sternocleidomastoid muscle. This is our sternocleidomastoid muscle. Okay, right. Next. So in the posterolateral surface, we have carotid sheath and its contents. So carotid sheath, which contains internal carotid artery, internal jugular vein, and the vagus nerve. So please write posterolateral surface of the lateral lobe, which contain carotid sheath and its contents. That is internal carotid artery, internal jugular vein, and the vagus nerve. Okay, right. Now in the medial surface, we have two tubes, we have two cartilage, and we have two muscle. Now two tubes means we have the trachea and we have esophagus. Now between trachea and esophagus, we have recurrent laryngeal nerve, two tubes, trachea, esophagus. So medial surface of the lateral lobe, we have two tubes, trachea, esophagus. Okay, we have two cartilage, thyroid and cricoid, and we have two muscle, inferior constrictor muscle and cricothyroid muscle, and inferior constrictor muscle of pharynx, inferior constrictor. Okay, right. Now see the diagram. Now this is the medial surface of the gland. The middle surface, yes, we are seeing the trachea, Now behind the trachea we have esophagus, and we are seeing the thyroid cartilage, cricoid cartilage, and we are also seeing the muscle, cricothyroid muscle and inferior constrictor muscle. Okay. Now these are the structures related to the medial surface of the lateral lobe. That's all about the lateral lobe: apex, base, and three surface. Now next we are seeing the isthmus. So isthmus is connecting the two lateral lobe. Okay, and we have isthmus is present over second, third, fourth tracheal ring. Okay, now we have two borders for the isthmus: upper border and the lower border. Now the upper border, this is the upper border, I am writing as UB, and this is a lower border. Now upper border, we see the anastomosis between the two superior thyroid artery. In the upper border of the isthmus, we see the anastomosis between the two superior thyroid artery. Superior thyroid artery. Okay. At the lower border of the isthmus, we see inferior thyroid vein. We see inferior thyroid vein. Okay. In the lower border, yes, we are seeing the inferior thyroid vein. Okay. And we also see arteria thyroidema. We are seeing this artery, that is arteria thyroidema. Thyroidema artery. Thyroidema artery, which may come from brachiocephalic trunk or arch of aorta. Okay. So these are two structures present at the lower border of the isthmus. Now these are the structures, they may get affected during the tracheostomy procedure. Tracheostomy procedure, you know, we are making some openings in the trachea. Okay. Now what are structures may get affected during the tracheostomy procedures? What are those? Isthmus of the thyroid gland. Number 2, arteria thyroidema. Number 3, inferior thyroid vein. Okay. So please write, please put one small box and then write structures may get affected during tracheostomy procedure. During tracheostomy procedure. Okay. Number 1, isthmus. Number 2, inferior thyroid vein. And number 3, arteria thyroidema. Okay. Please remember, inferior thyroid artery, it is not affected during a tracheostomy procedure. That is present more on the lateral side, which is not present over the isthmus. Okay. So it is not related to lower border of isthmus. So inferior thyroid artery is not affected during the tracheostomy procedure. Okay. Right. That's all about the isthmus. Next we are seeing the blood supply. So blood supply, we are seeing the arterial supply. So arterial supply by superior thyroid artery, inferior thyroid artery, and the arteria thyroidema. Now superior thyroid artery, it is coming from external carotid artery. Inferior thyroid artery is coming from thyrocervical trunk, very important. And arteria thyroidema, which is coming from the brachiocephalic trunk. Sometimes it may come from arch of aorta. Okay. Right. Now what about the venous drainage? Now we have 3 veins: superior thyroid vein, middle thyroid vein, and the inferior thyroid vein. Superior thyroid vein and the middle thyroid vein, they drain into internal jugular vein. Whereas inferior thyroid vein, which drain into brachiocephalic vein, which is not draining into internal jugular vein, which is draining into brachiocephalic vein. Okay, that is why inferior thyroid vein, it is the first vein, first vessel we ligate in the thyroid procedures. Okay, right. Now last one. So I told you already, the apex of the lateral lobe related to superior thyroid artery and external laryngeal nerve. So while ligating the superior thyroid artery, yes, surgeon may damage the external laryngeal nerve, and the base of the lateral lobe related to inferior thyroid artery and recurrent laryngeal nerve. So while ligating the inferior thyroid artery, the surgeon may damage the recurrent laryngeal nerve. Now recurrent laryngeal nerve damage is most commonly seen during a thyroid procedure. Now how to prevent the damage of the recurrent laryngeal nerve? There are many ways. Now the surgeon, they may define some triangles. By this, they may prevent the damage of the recurrent laryngeal nerve. One such triangle is the Behret's triangle. Now what is the boundary for Behret's triangle? Now see the diagram. Now in the diagram, we are seeing the common carotid artery. And here we are seeing the inferior thyroid artery, and this is our recurrent laryngeal nerve. Okay, this is a boundary for the Burgers triangle. So this is our common carotid artery, and here this is the inferior thyroid artery, and here you see the recurrent laryngeal nerve. So by defining this triangle, we can identify the position and the location of the recurrent laryngeal nerve, and the recurrent laryngeal nerve damage can be prevented. Okay, yes. So that's all about the thyroid gland. So next, parathyroid gland. Very few points are there for the parathyroid gland. So parathyroid gland, totally we have 4. We have 2 superior parathyroid, and we have 2 inferior parathyroid. Now parathyroid, superior parathyroid is coming from 4th endodermal pouch, 4th endodermal pouch, and inferior parathyroid is coming from 3rd endodermal pouch. Now superior parathyroid is constant in position, which is constant in position. It is usually present at the level of cricoid cartilage, which is present at the level of cricoid cartilage, whereas inferior parathyroid is not constant in position. Why, sir? See, inferior parathyroid is coming from 3rd pouch. Superior parathyroid is coming from 4th pouch. Why inferior parathyroid is coming from 3rd pouch? Because of thymus gland. Thymus gland is formed from the 3rd pouch. The thymus will descend. So along with the thymus gland, the parathyroid 3 also descend. So parathyroid 3 becomes inferior and parathyroid 4 becomes superior. So superior parathyroid is coming from 4th pouch, whereas inferior parathyroid is coming from 3rd pouch. Now I told you parathyroid 3, the inferior parathyroid descend along with the thymus gland. So because of that, the parathyroid, inferior parathyroid, it is highly variable in position. It is not having the constant position like the superior parathyroid. Superior parathyroid is present at the level of cricoid cartilage. Okay, whereas inferior parathyroid, the location is highly variable. The location is highly variable. Okay, right. Now both superior gland and the inferior gland, they are supplied only by inferior thyroid artery. So inferior thyroid artery, it is also called parathyroid artery. So parathyroid gland is not supplied by superior thyroid artery. That is the point. So parathyroid artery means inferior thyroid artery, that is the artery supplying the superior and inferior parathyroid gland. So these are some basic points you have to know about the parathyroid gland. That's all about the parathyroid gland, and by this we are completing the glands topic. Again, glands topic is a high yield topic. So we discussed the parotid gland, submandibular gland, thyroid gland, and finally some basic points, some few points about the parathyroid gland. Okay, so that's all about the glands topic.